Hello, my name is Liz Richardson and I'm the director of OTCES. I'm here outside of our OT clinic located at 131 West Grace Street. JMU's Occupational Therapy Clinical Education Services is a clinical program that offers OT services, specialized group programs, and resources for families. We're now outside the clinic. OTCES began providing services in March of 2010 and moved to our current location here in July 2010. Here at OTCES, our mission is to provide services that meet a community need, to provide opportunities for JMU students for learning, and to create an environment for research and collaboration. Come on in and take a look. Welcome to the clinic. This is our waiting area here. OTCES is in part supported by the Institute for Innovation in Health and Human Services and the College of Health and Behavioral Studies Dean's Office. And our current team consists of Cindy Colwell, who's our clinic and volunteer coordinator, Julie Patrick Bonham, who is our clinic supervisor, and myself, the director. The first room that we enter is the Play Center, and that's where we work with children on gross motor skills and coordination through group games, bike riding, and a variety of other movement activities. We also have a tent over here that provides a quiet, secluded place for children who might get overwhelmed with sounds and a large group of children. So our next room is the sensory motor gym, and this is a favorite for children of all ages, including our students. It provides opportunities for children to get their sensory needs met. And the primary systems that we are addressing in this room are the vestibular system, which is our sense of movement and where we are in space. Some activities that we might do to work on the vestibular system include our acrobat swing or the platform swing. The next system is the proprioceptive system, and this system is giving us an awareness of where one body part is in relation to another body part. So some of the activities we might do to address that system would include jumping on the trampoline or jumping and crashing into the ball pit. Third system that we work on is the tactile system, and that is our sense of touch. And some activities that we might do to address the tactile system might also include jumping in the ball pit, feeling what it feels like to have the balls covering your body. Another thing that we do is obstacle courses in here. So we might have a sequence of activities, for example, climbing through a tunnel, climbing over a barrel, jumping around or moving through space, so that a child can work on problem solving, sequencing, and following instruction. Next on our tour is our IPAC area, and the reason we call it that is because once a week we conduct the Interprofessional Autism Clinic here, but we also use it on other days as a quiet space to work on seated activities. Here in the kitchen we work on all kinds of skills. We might work on feeding, which would include managing utensils or drinking out of a cup independently. Might also work on movements of the mouth so that you can manage food more successfully. We also work on basic hygiene skills such as washing your hands, cleaning up after yourself, brushing your teeth. Another thing might be more independent skills, learning how to cook, learning how to do their wash, put away groceries. That can also involve a lot of social participation, learning how to work together. Another program is the Interactive Metronome, and that program is based on the traditional metronome, hearing a certain tone and trying to time certain movements in coordination with the tone that they're hearing. And this can help to work on problem solving, sequencing, impulse control, and attention. This area is specifically set up for the students who come, and they're either completing volunteer hours or they're doing their internships or what we call field work. We usually have about 30 pre-OT student volunteers here every semester. They're able to gain their observation hours that are required for them to get into OT programs. We have level 1 and level 2 fieldwork students who come and do their placements here at the clinic, as well as students from other universities and colleges who might be doing internships for a variety of classes. We call this area the Teen Suite, and we call it that because we set it up so that it might be similar to some place that you would find kids just hanging out. We wanted it to be a place that would encourage discussion, a place where kids might get together and play games or do puzzles and work together. We call this room our speech room, and that's because sometimes we do provide speech services here at the clinic, and it also is another area for us to work with children on more quiet types of activities that might require sitting at the table. This is what we call our stepping stones room, and this room is great for working on quiet activities. It has a lot of natural light, so that if a child is overstimulated by lights or sounds, we can bring them in here, shut the door, reduce the amount of auditory stimuli that there is, and turn off the lights. It's great for working on tabletop activities like coloring, drawing, arts and crafts. We also can work on keyboarding skills for some of our older children. We also are able to provide them with some adapted equipment as needed. Sometimes that might be a movable disc that they can sit on, or some kind of weighted item that they can put on their lap or across their shoulders to help them calm. That's the end of our tour. I hope you enjoyed it. For more information, visit our website or give us a call, and come visit us soon.